Hello and welcome back to day 3 of My Government Hates Me. This is my synopsis of everything that I read in Project 2025, my notes of concern. Yesterday I covered healthcare and I had so many concerns that I didn't get through everything in the video that I wanted to, so I'll be finishing that today and talking a little bit about agriculture. So I left off on the FDA. They want the FDA to reverse its approval of chemical abortion drugs because they said it was a politicized process from the start and it was not done correctly. They claim that abortion pills pose the single greatest threat to unborn children in a post-Roe world. They claim that because the FDA is statutorily charged with guaranteeing the safety and efficacy of drugs, they should therefore be required to withdraw this drug because it is dangerous to women and by definition fatally unsafe for newborns. They also want the DOJ to back them up on this and basically make it illegal to mail this kind of prescription through the mail. They also want to eliminate the week after pill Ella from the contraceptive mandate because they think it's an abortifacient rather than birth control. And if for whatever reason they can't get any of that to pass, they say the bare minimum should be limiting abortion pills to in-person dispensing and only being able to take it up to 49 days of gestation. We're just going to kind of broadly get into healthcare here. And this next quote just makes me laugh because it's so Republican, it hurts. It's basic economics holds that costs tend to decrease and quality and options tend to increase when there is robust and free competition. Healthcare is no exception. Glad we're still holding on to Reagan economics here. Anyway, they say in essence, our deficit problem is a Medicare and Medicaid problem. They think that Medicare and Medicaid operate as runaway entitlements that stifle medical innovation, encourage fraud, and impede cost containment. And of course, that's all they're worried about. They're not worried about us getting health care that doesn't cost an arm and a leg. First of all, they want to repeal Medicaid Part D. That replaced existing private sector prices with government price controls on medications. So if you take any medications and you've noticed over the last couple of years that your prices have decreased, I have personally, I have asthma and my inhaler used to cost me $291. Now it only costs me $119. You can thank the Biden administration for that. Of course, they want to get rid of that. They also want to make Medicare Advantage the default enrollment option. I'm not the best person to talk to you about this because I don't fully understand it, but how I understand it is Medicare Advantage is actually not the public option. It is a privatized option and it gives you less access to some medications. It can make certain procedures unavailable to you. Look into that. I don't have all the knowledge, but it is not a good thing. Of course, they want to require more robust eligibility requirements and determinations for Medicaid, which specifically pisses me off because I've helped my dad walk through this process in the last year, and it is already just mind-boggling how robust these requirements are. And they also want to add work requirements to Medicaid and targeted time limits or even lifetime caps on benefits to disincentivize permanent dependence. I know we already talked about abortion a little bit, but they make a big sweeping proclamation here that abortions and euthanasia are not healthcare. Their only quote for euthanasia was, "Legalizing physician-assisted suicide is a grave mistake that endangers the weak and vulnerable, corrupts the practice of medicine and the doctor-patient relationship, compromises the family and intergenerational commitments, and betrays human dignity and equality before the law." Which obviously, I don't think you should go into euthanasia willy-nilly. But we do it for our pets when they're suffering. How do animals, deserve this kind treatment when they are in pain and no longer enjoying life, but humans can't reach a consensus with their doctors? On the abortion side of things, they want to eliminate the terms abortion, reproductive health, and reproductive rights. That alone should scare you because how do you eliminate such all-expansive terms? They want to ensure that any abortion training for medical professionals is an opt-in rather than an opt-out. They want to withdraw the pharmacy abortion mandate, which forces pharmacies to stock and dispense first trimester abortion drugs. And then they want miscarriage management or ectopic pregnancy treatments to be called their own thing and not be called an abortion, which is what they are. Medically, that is the term. They also obviously want to prohibit abortion travel funding, and they want to restore Trump's religious and moral exemptions to the contraceptive mandate, allowing facilities under the ACA to rescind certain preventative services. And then it goes on to say that there should be no gender-affirming care for children, period. And then they also want to withdraw the Ryan White HIV and AIDS program, the ability to provide gender transition or gender-affirming care. And last in this section, I'm going to talk about sex ed. So obviously, Republicans have always been against sex ed because, they just want you to abstain completely. But obviously, we have seen that does not work. They state that the offices of teen pregnancy prevention and personal responsibility education programs should reassess sex ed, not to serve as advocacy tools to promote sex, prostitution, or a funneling effect to abortion clinics. They say that marriage, healthy family formations, and delayed sex to prevent pregnancy should be the focus. Risk avoidance should be prioritized, and any program that promotes risk rather than health should be denied funding. They also say that they want to use welfare funding to put towards health, marriage, and relationship education programs to teach healthy marriages and sexual risk avoidance, which, I can think of 1,000 different ways we could use that welfare money better. And then they also want to expand inclusion of fertility awareness-based methods to family planning. And that should also scare you, because what that is signaling is they want to get away from actual birth control pills and condoms. They want you to just use the old school methods. On top of that, they want to eliminate men's preventative services coverage, which means essentially condoms, from the women's preventative services mandates, which is access to birth control. Did you know you can get free condoms because of the contraceptive mandate? I did not know that, but it is true, and they want to eliminate that. I'm just going to finish up with the ag here, which is just a few points. They want the USDA to remove most governmental barriers that hinder food production or undermine efforts to meet demand, specifically includes climate change initiatives. What does that mean? They want to remove the U.S. from any association with UN and other efforts to push sustainable development schemes. They say organic food is too expensive to produce and too land intensive, which is just inherently false. They want to prohibit permanent farm easements for preservation of ecosystems, and they want to eliminate the Conservation Reserve Plan, which pays farmers not to farm parts of their land. I don't know if I have to tell you this, but there's a reason why there was a Dust Bowl during the Great Depression. It's because farmers didn't let their fields go fallow. They didn't revitalize their fields with nutrients. They only put down the main fertilizer ingredients of nitrogen, phosphorus, and potassium when there's so many more micronutrients in the soil. And of course, on top of this, their overall goal is to eliminate agricultural subsidies, especially the ARC, which protects farmers from shallow losses. So if you have anything less than a total loss, you just lose out as a farmer. And last but not least, they want to remove unnecessary regulatory barriers for meat and poultry to be sold. I'm sorry, did we not just have a boar's head recall recently? That's only going to get worse under the Trump administration.